For the second spring in a row now, Canada is battling several large wildfires.
Residents are now returning to Fort McMurray in Alberta, where nearly 7,000 people were forced to flee earlier this week. Meanwhile, at Fort Nelson in British Columbia, around 4,700 residents remain under evacuation orders as the fire continues spreading south. As of Sunday, there are 116 active wildfires burning across Canada. 9 of them are deemed out of control.
This closely mirrors June of last year, when the level of poor air quality from Canadian smoke set records across many cities here in the U.S. According to data that the government has collected, Air Now, that's a data source the government uses, it was deemed hazardous to breathe outside from Minnesota all the way through to the Mid-Atlantic region and down on through to the south.
Primary care physician Dr. Alex Chen joins us now from Washington. Dr. Chen, we've already seen air quality alerts in parts of the U.S. this year. Can you talk to us about some of the health risks that come with inhaling smoky air?
Sure. It is pretty alarming that we're already starting to see the smoky wildfire smoke coming down into the U.S. from Canada. Last summer was so bad. There's so much smoke, and we're going to have more of it because of climate change. There are many different effects that come from having smoke in your air, and they impact people who are more vulnerable, mostly, which is infants, children, elderly, people who have chronic conditions like heart disease or diabetes, and people who are pregnant. But for everybody, the impacts can be on your lungs. So having increased rates of bronchitis and asthma, wheezing, having itchy, irritated eyes, but also your lungs are the conduit between the air outside and your bloodstream. And so those particles get into your bloodstream and they can cause heart attacks, they can cause strokes, they can, in the long run, cause increased risks of lung cancer. And so there's a lot of risks to having all of the smoke in the air.
Doctor, I have a dumb question. Since, it's the summertime, people will go camping, they'll have campfires. No one ever says sitting around a campfire is dangerous for you, but you're getting some smoke in your face. What is it about this wafting of smoke from Canada, which is from a forest fire, natural source, right? It's not like soot coming out of a chimney or a factory. Why is it more dangerous than a summer campfire?
Because you're not sitting in front of that summer campfire for 1, 2, 3, 4, 5 days straight, just having your face over it. You're out and there's wind that's blowing and the smoke is going over across the lake. It's not like the concentrated, you saw those photos of, you can't even see the sky, you can't see the sun, you can't see the buildings that are on the other side of the city. That concentrated exposure to smoke is what's causing the challenge.
I think an important question. Last year, I remember I was covering when the air quality got pretty bad here and we were all wearing these N95 masks. You said with climate change, it's going to keep happening. What can be done? How can people prepare?
So as you mentioned, masks are really helpful, particularly when you're outdoors, particularly for people who have to be outdoors. If you work outside, you're in construction or agriculture, all these jobs where you can't be inside, wearing a high quality mask, an N95, a KN95. If you don't have to be outdoors, being indoors, especially when the air is particularly bad, when it gets to those orange and red levels, being indoors as much as you can. Having a HEPA filter, if you're able to get one, to clean the air when you are inside. All of those things can be helpful. If you have asthma, making sure that you have your inhalers, that you've called up your doctor and you've gotten your refills on your script, so you're not caught sort of in the middle of the night and you're wheezing and you can't get help.
Yikes. Dr. Alice Chen, I feel like the world is becoming less and less livable by the second, but thank you very much. I wish we had better news to share. Well, go ahead.
It's getting less livable, and yet there's so much work that is being done on climate change, which I think is so critical for us to know that the Biden administration has put so much money and so much investment into clean energy that this does not have to be our future. We don't have to spend every summer in a KN95 mask sitting in our homes. There is work that we can do, and the investments that our federal government, that we as taxpayers have all put in, that is going to help us move to a better future.
Crucial hope there. Thank you so much, Doctor.